eye health in the workplace is unbelievably important, and we'll talk about that in the company of two very distinguished guests a little bit later this morning. We have two regional health ministers with us today. Day two, well, it wouldn't really be fair to choose any highlights from day one, but I'm going to anyway. I'd love to know your highlights as well. Here's just a couple from me. We were joined on this stage, and now you can see across the pages of Nepal's newspapers, by the Prime Minister himself, a highlight for this event in all of its years. We were joined, and many of them here with us this morning, by some incredible young systems leaders. Let's hear it for them. And if you'll indulge my personal highlight, it was going into the salty gardens in the evening air and seeing hundreds of colleagues and friends connecting, reconnecting, plotting, and frankly enjoying the wonderful hospitality that we've had here in Nepal. So let's just say another huge thank you to everyone for making us feel so welcome. And there's lots going on today as well. So to the program now, I've just got a couple of reminders, if you like. If you're not already navigating using the app, please do. It is brilliant. It is a who's who of who's here. It's every session on there. And you've got good things on there, like the poster displays on there as well. You've got things like the Vision Atlas quiz. I've got to tell you, the best live demo I've seen this year, and I see a lot, was Jude demonstrating the Vision Atlas earlier this week. It is a sensational piece of work. I absolutely commend it to you. We have got some incredible exhibitors through here in the gardens just to your right. Can we have a round of applause for all of our exhibitors who are showcasing their work? Over there in the Manjari Gardens as well. So 23 different booths, loads of conversations to be had. We've got lots to get through across the venue today, so it's lovely to get everyone together. So while I'm here, I'll introduce you to our first three guests in a second, but I've got a big question for you all. And it does involve you getting up and telling, and you can play this online as well. It does involve getting up and telling your neighbor your answer to my quiz question. So everyone just stand up just momentarily. Let's quickly stand up. Everyone front row, there we go. If you're able to stand, please do. And here's the question. Here's the question. If you could redesign the global health system from scratch, we've only got 30 seconds for this. No, if you could redesign the global health system from scratch, what would you keep? What would you change? What would you leave out? Turn to your neighbor, tell them in less than a minute, and let's get this room full of ideas. From scratch. Good morning. Nice to see you. Yes. How are you, sir? Jonathan, I'd like your answer for that in a minute, Jonathan, as well. Yes. Ready, team? Are you ready, Astra? Shall we? Shall we? Now, we'll double check with the team where they want us. Okay, thank you everybody. Please have a seat. Thank you. And I'd like your answers in the coffee breaks. Katie, have we sorted it? We solved it? Done. Right, we're done. That's what happens when you sit between Amanda and Jackie Grove. Right. Welcome, guests. Welcome back, everybody. This promises to just be, I think, just a really engaging conversation, not just in terms of our conversation on stage, but also in terms of what I hope it will trigger across the rest of the day in the corridors over the coffee breaks and so on. The title is The Future in Focus, Eye Care in a Changing World. Changing would be an understatement, I think. Our guests will agree. And it's about big shifts, it's about bold ideas, and I hope it's going to be about the power of partnership as well. So let me tell you who our guests are. And let's start at the far end. Dr. Akramul Islam. He brings decades of hands-on experience in the heart of development research, public health, innovation, and humanitarian response. Senior Director at the BRAC Health Program, has helped shape health systems across some of the world's most complex environments. Please give Dr. Akram a warm welcome to our stage. Welcome. So if you want to talk about the cutting edge of technology and entrepreneurship, look no further than our second guest. Lina Emanuel is the co-founder of BrainSight AI, and I can't wait to hear more about it. So this is transforming how we understand the human brain using 3D visualization. That's my way of explaining it. We'll get yours in a second. So hopefully we'll hear what happens when innovation meets real purpose. Lina, please welcome Lina to the stage. And here, a sort of triple threat, if you like, because we've got an ophthalmologist, a policy leader, but also a really strong advocate for eye care. Globally, Dr. Azra Herzeg is with us, who also is about to step into the European chair at the IAPB itself. So really someone who's helped shape health agendas around the world, a former state secretary in Slovenia, but also a former deputy minister of health. Please give Azra a warm welcome. So team, let's just imagine our panel was only, you know I like pithy, if our panel was only 20 seconds long, and you could only say, or only 1 minute long, and you had 20 seconds to talk about eye care in a changing world. Azra, what would you say?
So just keywords. I would say resilience, coordination, transparency, accountability.
Love those words. So transparency, accountability, here.
I think I still have time to spare.
Yes, you do. and you're right, you had seconds to spare as well. Lina.
I'm going to take Azra's cue here and say transparency and accountability, especially because I've worked in this space and I know how much of a difference it can make to how services are delivered. So yes, transparency and accountability.
So underlining those two words. Akram.
I will say that's based on human capital. That's maybe a more powerful at this point to investing on the human being and then creating them empowering them to solve the problems by themselves.
Yeah, absolutely.
Thank you.
And by the way, team, if we can get more microphones on stage, we've... oh, no, we've got them. I think we've got... Have you got your own, Lina? Yeah, if we do have one more, we'd love one. Thank you, forgive me. So I think just a little bit more, just because I'm really fascinated in what's keeping you busy at the moment. Azra, a former Deputy Health Minister, you escaped.
I have, successfully.
Just help us understand what's keeping you busy at the moment.
At the moment, well, I'm at the National Institute of Public Health, so many EU projects and some research works.
Yeah, got it. Thank you. And Lina, that was my way of describing what you're doing. Put it into your own words, please.
Sure, absolutely. So BrainSight AI essentially does advanced functional mapping of the brain. So it maps out things like your language, sensory motor, and also, because neuroscience has moved so much over the past few years, it also helps in mapping cognitive functions. So things like your attention function, your default mode network, which is like your network of networks. So that's the work that we do. What's keeping us busy? Well, we were just named the top 100 AI companies in the world. And so we've been looking to kind of live up to that reputation.
Congratulations.
So, yes, thank you.
And you've had a significant funding round as well.
Yes, indeed.
Yeah. And recognized in the Financial Times as well, I noticed, as well, in one of their startup lists. Congratulations. And just very briefly, Lina, just the stage of the company, you have revenues?
So we are just about starting our revenues. We now have contracts with hospitals which are using us. Yes.
Yeah, congratulations.
Yeah,
Great.
thank you.
Dr. Akramal, what's keeping you busy?
Yeah, so my role is basically, the shaping the BRAC's health programs, particular focus on this changing world. When the resources are being scarcity and then the humanitarian crisis is being increasing globally. Yeah. So that's my main role in BRAC to redesigning the health programs, which including the eye care, both in complex humanitarian settings as well as the development settings. So that keeps me busy to deliver the business in the new way, to having the impact on the people's life. Yeah. That's why I've been busy me.
No, thank you. And you've given me an idea, because I'm going to come to you on the big question I asked the audience first, Akram, because I think you're all well placed to answer it. Lina, the thing, so chapter 1, if you like, of our discussion, I think, should be about thinking about the big picture. And the thing that's been on our minds a lot, Lina, is these huge developments in technology. But the thing that haunts us is the idea of people getting left behind. So how do we make sure that doesn't happen? What are you seeing? And how do we ensure that it doesn't just benefit the people that can afford it?
Absolutely. And I think that's a great question. Well, technology by itself, I mean, the kind of work that we do, connectomics, is a very advanced stage. And it's a very advanced technique. And it'll slowly only percolate to people who are left behind. So I think there is this piece about new technologies will get adopted by people who are at the very cutting edge of technology. But then how does it move to people who don't have access? And I really like what Mr. Atul Gawande had said, that there are some technologies that get adopted very easily, and that's because it creates value for each person. It creates value for the doctors who are using it. It reduces their time. It reduces the effort they put. It creates value for the patients, which we all know that that's what technology is meant for. And then there are technologies which are great only for the patient, but not so much. It increases effort for the doctors. And I do think that when new technologies come in, and if you look at an entire ecosystem and build to benefit all of the people in the ecosystem, that's when everybody gets involved, and that's when it percolates really fast down to the last mile.
Right, so in your situation though, we talk about the ability to map, the ability to better understand the brain. Where are the actual costs going to be involved? Is this going to require new hardware? Just give us a sense of that, because that helps us think about access.
Yes, so in our case, we worked really hard to be able to work with existing MRI machines in hospitals. So the way connectomics was being developed was it required really advanced MRI machines earlier. But our team worked with existing MRIs, those old machines which are almost out of service right now, and because that's what's available in a lot of the remote places across the country. So we really learned how to work with those. We used AI to be able to do a lot of the signal processing. That's how we used all of that and got to a point where now we are available in even the smaller MRI centers across the country.
Right, thank you. Can we have a show of hands? All brain scientists in the house. Show of hands. Oh, Jackie Grove, I don't know whether you're teasing me or not. I think you may be. In that case, a quick reminder on connectomics.
On connectomics?
Yes.
A quick reminder.
Yes. For those of us who aren't familiar.
Oh, okay. Yes, sure. Connectomics is essentially looking at the structural and functional connectivity of the brain. Think of it like mapping the electrical circuit in a room, but also mapping how when you switch on a light, different lights go on, right? And so these connectivity patterns in the brain are incredible. They can be used for understanding these functions, as I said, for neurosurgeons. But it's also one of the earliest indicators for things like dementia. It's also one of the only body-based indicators for psychiatric disorders like schizophrenia, bipolar, OCD, major depression, and can then be used for your prognosis and diagnosis of these disorders.
Yeah, can we just appreciate at this point that I frame this as the big picture, and I've encouraged you off down a rabbit hole because it's so fascinating.
Yes,
So we will pull back out. With ASRA, we're seeing these huge changes economically, politically. How do you see those, from your perspective, impacting the world of eye health? And how do you think we should be considering our response?
Thank you for the very interesting question. Well, I think there's no denying that we're currently living in quite challenging times. I would say that the world is shifting and we don't actually know what lies ahead. Mm-hmm. So there's big uncertainty, and that's certainly showing in many aspects, like global economy or healthcare. Because, you know, we have some players who are very unpredictable at the moment. We have some large-scale conflicts in the world that just don't seem to want to end. And then we have a shift towards defense capability building from many countries, like also the EU. And we know that when we're going toward defense spending, some budgets need to be cut. And historically, we also know that it has been healthcare, social security, education most of times. Mm-hmm. And I think that we can see early signs of that happening. But, you know, I think that in every challenge also lies the opportunity. And I think now, more than ever, we are actually forced to find new allies, new alliances, and to work together. And I don't mean only in one sector, only in eye health sector or only in healthcare sector. We need to make connections with education, with labor, disability, but also I would argue that maybe we shouldn't overlook the defense, because, for example, the EU gives some unallocated funds into the defense sector, which means that it doesn't have to go straight to the military. It means building the capacity, and that also means healthcare preparedness. And if you're framing eye health as one of the main contributors to quality of life and productivity, well, then probably it also has something to do with national defense capacity.
Yeah, so just very briefly, Lina, on that dual use, I mean, funny enough, we've seen actually through technologies initially developed for people with disabilities, the mouse, the touch screen, end up having billion-dollar potential in other areas. Lina, is that something you'd even begun to explore? Because frankly, you know, that sort of mapping would be very useful for national governments and their frontline forces.
Absolutely. No, I think there's tremendous applications of connectomics for various military applications as well, and defense and eye care. I mean, I think the gamut, the brain is the final frontier, right? Like, it's where you want to, there's not all of the other organs you've been able to understand over time. Brain is the one organ that till today we don't really understand fully, and the more you understand it, the more applications come out of it. And so there are applications on how it can be used for traumatic brain injury, for patients, for military patients. It can be used for as I said, for a lot of the psychiatric disorders, which till today have never had any kind of very body-based objective indicators for it. And even in the eye health space, I think the eye is the window to the brain. And there are so many there's so much new research coming on how, by understanding the eye, you can actually predict a lot of the brain health. And so there's like such a great combination between the two.
That two-way flow. Akram, blank sheet of paper, redesigning healthcare. What do you keep? What do you ditch? What do you change?
Yeah, thank you. I think this BRAC is basically the people-centric, solution-driven organization. So we really value the power of the people. And looking on that lens, what we do in the BRAC, I will start with example of the eye care and then move it to the broader health perspective. So the solution for the eye care basically looks into as a livelihood component. It's not the solution of the eye only. So if we can solve the eye problems, they will improve their own livelihoods. That's the one fundamental spirit that we have it. So that's why we broaden in the health eye in our development arena. So that increase the livelihoods, that they can income improvement, and then they can bring it on. But similarly, when it looks in the eye alone, eye care alone may not be possible to move forward in a bigger scales. So we thought it should be part of the development process, not only the health, and also it should be a part of the primary health care, instead of only the eye care process. So we built this eye care as a component of the primary health care, and as she said that thinking in a financial situation of the country, globally, the gradually shifting of the foreign aid. So what we have been actually designing right now, that mobilizing internal resources for the microfinance surplus, because the microfinance credit borrowers has a big impact on his own livelihoods if they don't have a correct eye visions. So really they can't earn that we expect for. So we argue on the organization, so why don't you have a part of the profit to be merged on the health, which is including the primary health care. So along with that principles and discussions, basically we allocate our own internal resources rather than depend on the external resources to the primary health care. And eye is part of the primary health care, so you don't need to be a kind of a parallel interventions that need to go in that part. So our frontline health workers, they screen the peoples, they provide their eyeglasses, and we have a very big partnerships created since 2006 with the Vision Spring, and 2011 with the Sight Savers. With the two big partnerships, basically we give a big push in the country along with our development program. So that's why we see a kind of a bigger, eye is not a kind of a way of that one single element that we need to address on that. It's a part of the livelihoods, part of the inter-health improvements. That's what we looked into it on the ground.
Yeah, thank you. Now, Azra, I do want your take on this as well, but Lina, as our sort of resident entrepreneur, very often countries are sort of saddled with their incumbent systems, the way things have evolved. They wish they could change things, they just can't. Let's give you that blank sheet.
Right. I think entrepreneurship is hard. All of us know it across, no matter which country you're talking about. I think I could talk about all the enablers for entrepreneurship. I could also talk about the 100 things that go wrong when you're starting off a company. I will start with talking about enablers, because we've come so far. Like, deep research into the brain is often the prerogative of very rich universities. So being able to bring that research out into the clinical world is a hard task. And in a country like India, where resources are required for so many different things, right? Like being able to finance high research and deep research is a hard ask. So what it means for entrepreneurs like me is that I am constantly going around fundraising, figuring out which investors in which part of the world might be interested in the problem statement that I have. We have managed to raise multiple rounds of funding right now, but it takes a lot of effort. So I think that's one key enabler. I think also governments, I think there are also a lot of government schemes that the Indian government has now come out with, where they are working with the scientists in various research institutions and providing grants. So I think those grants have helped us go through really difficult periods like COVID. And those are not, what I really loved about it, those grants are given to people who are entrepreneurial. So it's a very good match between people who are entrepreneurial using their skills and the government then allocating their resources very smartly to only those entrepreneurs.
Yeah,
so I think
I suppose the challenge for you all, and Azra, getting your thoughts on this is, let's have an example in the UK which may resonate. You know, we are saying we need at least 3 big shifts, you know, towards prevention, towards digital, and towards the community, okay? Well, that suggests that where it is now isn't in the right place. So if we were designing from scratch, to what extent would we start in those 3 places? And where do we go wrong is a separate panel, but where would you restart?
Well, you know, starting from scratch, what I've seen continuously at the ministry and also not just in healthcare, is the lack of communication between stakeholders and the different sectors. So I would really start with multi-stakeholder agreement. And that's not so very interesting to hear, right? But I think it really is the foundation upon which you then can build accountability and transparency. And I think that's something that's in a way very much missing, not just from healthcare and from politics, but in all aspects of our society. So I would really start with that. And I strongly believe, and I really do believe, in universal healthcare coverage. So that's something I would really expand globally if I could.
Yeah.
Today.
Right. Well, I say Azra for president. I say on that. I mean, just help us to capture, Azra, how you would envisage place this in today, if you like, a thriving partnership with the private sector. We have world-changing entrepreneurs here. There's an opportunity for you as our future president.
Well, you know, since we're here at this topic and with this guest of here by my side, who knows so much more about this than I do, but I'm really, really, really excited about the AI technology and the progress it can bring with it. So I think the partnership there is sorely, sorely needed because, yes, I can see how it can bring divide. But I can also see how it can improve access in the most remote areas. Yes. Because you can build the telecommunication networks, consultations with the specialists that are missing in some areas, screening programs. And on the other end, the high end, I'm so very optimistic, and this is quite sci-fi, I know, but with quantum computer chips coming and their capabilities and the AI involved, I'm so very optimistic that we can bring the disability devices on such much higher level than we have today.
Yes.
And I'm also talking maybe the one day usable computer vision chips.
Yes.
So, but I didn't really answer your question.
No, you did. No, it's fascinating. And I'm tempted to remind, what is it?
I really need
what is that lobe? What lobe is it, Lina, in the brain? It's not the occidental lobe, but that's responsible for visualization. But
well, what we've realized in our work is actually, it's not areas of the brain that are involved, it's networks of the brain. In fact, that's what connectomics actually, the big insight from connectomics and how surgery was practiced for hundreds of years was they would identify certain areas of the brain and those are associated with vision, those are associated with language, etc. But what we've realized, it's entire networks of the brain, and if you don't actually look at the entire network, there are other parts of the brain that you might affect during surgery. Right. But I also wanted to bring back to that question of eye care and tech and just bringing those two together. I feel like I feel like your work is so important in this because what I do believe is that low-cost eye care is not only good for vision, but it's also really great for understanding the brain and understanding the various disorders like dementia, like There's now new research coming out on how, using the eye scans and analysis on it, you can look at other more serious illnesses as well. So there's just so much that can be done just with
including
eye
rare
care.
diseases that might otherwise have been overlooked because they were too costly.
Yeah, absolutely.
And so Akram, so far our takeout is we need systems and political connectomics in our future plan, which brings us on, doesn't it, to collaboration. So let's have some real examples of where you've seen a collaboration really move the needle. Where would your mind go for that?
Thank you. So I just also touch on the two other colleagues that you were saying, you know. In eye care, you know, there are multiple actors on the ground, you know. And some are large private sectors, some are small private sectors, some are small entrepreneurs are there. So it's being there basically. But the issue is that how do you connect with them? How do you work with them? And that's not being tested yet.
Yeah.
So traditionally being, you know, every country has those big providers are available. So I think that's one of the areas that we really need to explore, how strong we build the relationship with them, connect with this quality of work for that they provided it, and the link with the, you know, the
especially how the very large works with the very small. It's that asymmetry that could unlock.
Absolutely, yeah. And the second part is, if we look at eye care, I think we also need to look as in a bigger part of the development side. No, it's not only this focused on the eye corrections. Because if it looks at the eye vision impairment among the children, the whole life is unproductive. So really need to put this story, the narrative very well to the development area, to the public policy makers, that you really need to invest on there.
Yes.
Otherwise, this population will really doesn't have a contribution to your national growth. So the narrative needs to be changed from the biomedical to this development area. And that's missing at this point in the eye.
Yeah, and again, it's joining those dots, isn't it? It's not just about exam results. It's about confidence, about agency, about inclusion.
Inclusion, agency, and then also building them their own life, the whole throughout the life, to contribute to the economy.
I'm going to come back on that collaboration, though. What have you seen, and let's get everyone on this, what have you seen when two maybe unlikely alliances come together and it really shifts things? Akram.
Yeah. So I think it's possible these collaborations to be happening at the country level if we really be committed for that. As per Bangladesh, what we do it with our partners working together, that we have been working both in the private sector, we've been working both in the public sectors. And you know, the speed of private and public is different, you know? So, and that you need to be patient. And you don't need to be, you know, the same expectation that you are expecting from private sectors, you will get in the same level of speed of the public sector. So that you need to be patient, but you need to continue your business. Continue pushing this needle. And also connect the development groups, the policymakers, on the discussion and dialogue to create a new narratives of the eye issues. You know, that's by missing.
All right, so on that then, let's have an example, if you don't mind, on the public and private sectors at their best, where you've seen them thrive, because I think stories will help us cut through skepticism.
Yeah, so I'll give you a few examples, you know. I'll give you two examples. That could be good for a kind of you know, my colleagues to be over here. As for BRAC as a development organization, so what we do, use the very simple tools for screening the cataract. And then basically we provide the link with the hospitals that do the surgeries. And then we have an agreement with the hospitals so that they need a profit, but they need to really doesn't make that maximum profit. So it's kind of a more cost-effective way of, you know, making the surgeries, all this kind of thing. So that's a good example in Bangladesh. We work closely with the site savers.
This is perfect. This is perfectly timed. Yes.
And you will be believing, is more than 200,000 cataract surgery we did with this partnership model. It was a huge numbers. In fact, the impacts. So we changed the lives of the 200,000 people. Can you imagine it? Putting them in the normal livelihoods, having them, you know, if we multiply 4 or 5, this whole change of the whole livelihoods and incomes. Working with the Vision Springs, you will be surprising to know the numbers. we corrected almost 2.6 million people's eye corrections. And we're starting this partnership in 2006. So with a simple pair of glasses, because they don't know they'll say that this is maybe a problem, my age is there, so I don't need to be correction, and so I need to, this will not be changes, you know. But once they change the glasses small, it's about, you know, less around $2, you know,
Yes.
for simple glasses. And very simple tools for screening. The community health workers can do it. You don't need to be very doctors in every villages. The community health workers, which is being trained with the simple tools, they screen it, and then I just distribute to these eyeglasses with them.
Yes.
And they are being afford this care. It's not they cannot afford it. You really can sell it, and we sell it.
These numbers are massive, and this is a well-timed intervention. We're joined by two honourable health ministers in the auditorium today. So on this theme of looking to the future and partnership in particular, Lina, in a moment, I'm going to move us only because I want us to get to even further in the future. Akram, thank you, sir, for the moment. Lina, I want to come to what gets in the way, but whilst we are speaking internationally, Azra, how can we foster collaboration between borders, between countries? You know, you've seen it from that even bigger picture level. What is needed to accelerate that? We've got so much to learn from each other. We've got so much that we could be collaborating on.
Well, I think the first thing or organization you need is a mediator, because someone to start the discussion. And here we have, we have IAPB,
Yep.
but we also do have WHO, the United Nations, the EU.
Yeah.
But also we need a team, we need a well-prepared policy ask, we actually need some plan, what are we going to discuss?
An investment case.
For example. And I think if we prepared that very well, then we can move a lot, yeah.
Right. So let's get down to the reality of when these sectors come together, when these collaborations come together. Lina, forgive me, I'm going to ask you to be feel free to pile as many points as you like in. What gets in the way in practice, but what have you learned about how to get through and actually make it work?
Well, what gets in the way of entrepreneurship? Almost everything. I think one of the, everything from funding to, funding, which I already talked about, is one of the hardest things. And I think it's hard to convince people about new technologies when there are so many other problems to be solved. So really making a business case for why this technology can change people's lives is something that needs to be built. So that was the funding part of it. And I think also I talked to, more than 500 investors.
Wow.
That could also be the reason why we raised funding. But apart from that, the other thing which was a big problem for us is Connectomics is very new. I mean, we are one of 2 worldwide companies doing this kind of work. And so doctors themselves, who are very risk averse, don't like to adopt new technology till the risk is proven, and which is perfectly, I think it's a very, very legitimate demand, right? But like getting those early adopters to come in and experiment with us, giving them the correct incentives to experiment with cutting edge technology, I think those things really worked well for us.
Yeah.
In fact, the government of India had these research programs with the hospitals, which we could then fit our work into. And that's when the doctors were willing to experiment at a very cutting edge technology. So I think these were some of the things that helped us survive the first 4 or 5 years and come to a point where today doctors, all neurosurgeons across the country use our work before they conduct a surgery, a brain surgery.
Yeah, well, kudos for the progress you've made. If you're just joining us for our honourable guests, this is 3D mapping of the brain to actually sell that solution into hospitals. So really, really powerful solutions here. Thank you. So let's gaze into the future, the big opportunities that you see. I want from all of you, but just to say, Azra, so you don't accuse me of surprising you, for you, I'd like to know what skills and qualities you think our leaders are going to need. Yeah? Lina, I'd like your thoughts on the trends, particularly in tech, that most excite you, for impact in particular, right? Yeah. But Akram first, the big picture. What do you see as the biggest opportunity, really, to drive solutions in health, for people in this room, to really make a lasting change?
Thank you. I think what I missed in the earlier talk, that we really need to build a small micro-entrepreneurships. What we have now in the community health workers, we give the pairs of the eyeglasses, and they know the how to make the screening. And by providing the pair of glasses, they also get incentives.
Yes.
So it's a kind of a way of encouraging people to be micro-entrepreneurs. It's even impossible even in the eye care.
Yeah.
So the second part, because since the ministers are here, because we also have been closely engaged with the industrial sectors. Yeah. Because in industrial sectors, there are many girls and women have eye problems. So they really doesn't make the progress that they wanted to have it. So we do a free screening and encourage them to use the classes. So the industry owners get a lot of mileages. I think that's the ministries need to take care of it through a policy advocacy for that. There's industry owners or the public sector industries that need to be annual checks of these providers, workers, and that improve their own productivity. The third part of what I would like to say this in the future looking into is what we are actually planning in BRAC in Bangladesh. So eye is now integrated with NCD and mental health. It's not alone actually.
Yes.
So it's not possible to single item to move forward in the coming days when resources scarcity. And you really can't have three sets of human resources to be fragmented way. So we integrated all three and put it on the ground with the know-how basic with the community health workers. So they do a maternal child health, they do NCD, special hypertension, diabetes, because that's also linked up with your diabetes, linked up with eye care. You need to link up with that one.
Yeah.
And also the mental health, that's very much needed on the caring for their own and well-being in life and basic screening of the eye. So I think going forward, we really need to on the system process and also closely work with the public sectors, because we really can't solve the problem by all single agency.
Yeah, it is that joined up approach. Now, only because we have 3 minutes remaining, I'm going to say thank you for now. Azra, the qualities and skills that our leaders will need.
I will start with the Miss World answer. So I think transparency, good intentions, and accountability are the idealistic ones I would put ahead. But more pressing, I think what we will need in these years is resilience and preparedness. And I think that takes a lot of adaptability. So if we're talking realistically, I would put that in the forefront. And I think that maybe there is reason to be optimistic, because if we look at COVID crisis that we had, well, I need to say it was a different crisis than what we're facing now, because essentially it was a healthcare crisis. And it has drawn attention to healthcare and provided many opportunities. But we have seen, if I'm talking EU level, because that's the one I know better, we've seen the rise of HERA. We've seen greater importance put on EMA and the rise of ECDC. Yes. So there were big developments, and it came from someone being inventive and taking the opportunity that was presented.
But also that radical approach to forging new alliances, that huge generosity of spirit in creating data lakes, capturing that.
So let's hope we've learned something from that, and we can capitalize on it now.
Right. Now, thank you, Azra. Now, it's easy to get sort of bamboozled, isn't it, by all of the developments. But what excites you most? But particularly, not just because of the staggering level of innovation, but because of how it could change lives.
So you asked me about the technology trends. I think the 3 technology trends that are going to change the world, I think, is the combination of biotechnology, AI, and quantum. And the 3 of them come together in a way that 1 + 1 is actually 11, not just 2, right? Quantum computers allow you to mine large levels of data, and AI techniques allow you to do that more efficiently. And there's the biological data. There's now so many communities of scientists working on some really incredible questions, and which AI and quantum can make together. So just a couple of examples. Connectomics came into clinical practice only around the past 2-3 years. There's a new field called exposomics, which looks at the effect of environment. The combination of AI plus quantum can help in understanding from eye scans how to do prevention of bigger disorders. There's just so much that can be done with the combination of these three, and it's really the final frontier as of now. I'm sure in a couple of years there'll be a new final frontier.
And on that, is there any type of organization, or feel free to name them, that you'd like to collaborate with a bit more closely?
Well, I mean, we in fact collaborate with universities and organizations across the world, and some of the larger ones are like the human brain mapping in Europe. There are universities like Stanford, etc., where we have presented our work. So I think there is a lot of interest in these advanced technology, primarily because of the way it can change the world.
But if you could have one chat following 2030 Insight Live that says, that's a breakthrough, what would it be?
Sorry, say that again?
If you could have one conversation following this event as a breakthrough for the business, because we want to be a helpful community, we are a helpful community, who would it be?
I would love to be able to talk to the leaders here and see how connectomics can be brought to the hospitals in Nepal, because I think hospitals in India have loved what we've done, and I do think that across the world, being able to conduct safer surgeries is a thing that all hospitals aspire to. So,
right. Yeah. Well, that's your coffee and lunch breaks fully booked. Lina, thank you. And indeed to Azra, to Lina, and to Akramal. Thank you very much indeed for getting us thinking so brilliantly. Thank you. Well, as our three brilliant guests leave the stage from the front, I'm going to introduce our next honoured guest, but not before I've asked you all to stand up if you're able to, just to reflect with your neighbour on the one thing that struck you most that was said on that stage. Let's stand up just for a minute and share, yes, the one thing you thought Thank you, everybody. Welcome back. We're keen to hear how you've been redesigning health systems. I mean, thank you, everybody. So yesterday in this room, we saw the power of what happens when leaders come together with purpose to make commitments. And it is a sign of commitment that we have not one but two provincial health ministers with us from Nepal this morning. We're incredibly grateful because they have their hands on the levers of power that are so crucial. Even in today's announcements and yesterday's announcements, we saw that change of eye health being included in insurance. So change is possible, and it's happening. And that's why we're so grateful for our honourable guests being here this morning. It's my pleasure to introduce to the stage the Provincial Health Minister for Lumbini. Please give a warm IAPB welcome to the Honourable Minister Kem Bahadur Saru. Welcome, sir. Yeah. How are you?
Thank you, dynamic master of ceremony of this mega conference, respected chair of this mega conference, 2030 Insight, organized by Nepal, Honorable Minister of Health of Bagmati Province, all the delegates from different countries of the world in Nepal. Namaste and very warm welcome to you all here. It is Namaste and very warm welcome to you all here. It is distinct honor for me to address this esteemed gathering on the occasion of International Labour Day, here at the IAPB 2030 Insight Live meeting in our beautiful capital city, Kathmandu. Today, we come together not only to advance a global vision for eye health, but also honor the dignity, resilience, and contribution of workers across Nepal and the world. On this day, dedicated to laborers, we are reminded that it's not separate from rights. It is central to them. Without good health and without clear vision, not workers reach their full potential. Whether in agriculture, construction, transport, domestic service, or in the informal economy. In Lumbini province, home to both historic significance and hardworking population, we are committed to transforming our health system to be inclusive, equitable, and accessible, especially for those most in need. Eye health is a key component of this transformation. We recognize the disproportionate burden of avoidable blindness and vision impairment on our labor force, particularly among the poor, the elderly, women, and those in rural areas. These challenges are not just medical, they are economic, social, and deeply human. That is why we align ourselves with the goals of the 2030 Insight strategy and reframe our commitment to integrating eye care into universal health coverage. Our province is collaborating with national stakeholders like Nepal Netra Jyoti Sangh, NNJS, local governments, and eye care institutions to expand access, build human resource, and must guide our policies, as well as to strengthen community-based services. The voice of workers must guide our policies, their realistics must shape our programs, and their well-being must be the measure of our success. The Labor Day, let us recommit to a shared vision, a Nepal where no one becomes blind due to lack of care, a province where every person, regardless of income or status, has the right to see clearly, live fully, and work with dignity. I extend my heartfelt appreciation to IAPB and all global and local partners for uniting efforts to make this vision possible. Let us collective action today brighten and path towards 2030 with clearly compassion and courage. Thank you very much.
We'd like to recognize your presence and contribution with a small gift. I invite Peter Holland, our Chief Exec of the IAPB, to the stage. Peter, thank you. Our thanks to the Honourable Minister. We have another address now from the Provincial Health Minister for Bagmati, and our honourable guest will speak in Nepali. So if it's not an imposition, I might suggest, YD, perhaps maybe just a very brief reflection afterwards, just a couple of sentences to summarise. I'll just put you on notice so you don't step out of the room, if that's okay. I know you wouldn't have done. It's an absolute honour to welcome the Honourable Minister. Please, let's have a warm welcome for the Honourable Minister, Kirin Tapa. Welcome, sir.
हस् धेरै धेरै धन्यवाद यो 3 दिनसम्मको सम्मेलन कार्यक्रमका सभापतिज्यू यस कार्यक्रममा उपस्थित हुनुभएका लुम्बिनी प्रदेशका स्वास्थ्य मन्त्री माननीय स्वास्थ्य मन्त्रीज्यू राष्ट्रिय तथा अन्तर्राष्ट्रिय आँखाका विशेषज्ञज्यूहरू र उपस्थित सम्पूर्णमा सर्वप्रथम मेरो हार्दिक अभिवादन एवं न्यानो नमस्कार। 2030 साइट लाइभ कार्यक्रममा उपस्थित हुनुभएर स्वास्थ्य क्षेत्रमा विशेष गरी आँखाको क्षेत्रमा यो सम्मेलनबाट अवश्य पनि हाम्रो जस्तो देशमा यो आँखाको समस्यालाई यसको उपचारलाई यो सम्मेलनले अझ टेवा पुग्छ भन्ने मैले आशा एवं विश्वास लिएको छु। आज स्वास्थ्यको क्षेत्रमा 28 वटा अस्पताल 224 वटा सेवा केन्द्र सञ्चालन गरेर वार्षिक 30 लाख भन्दा बढी सेवा आँखाको सेवा प्रवाह गर्दै आइराखेको छ र यो सेवालाई अझ निरन्तर दिनको लागि र बागमती प्रदेश स्वास्थ्य मन्त्रालयले आगामी वर्षको नीति तथा कार्यक्रम र बजेटमा यहाँहरूसँग साझेदारी गरेर र आँखाको क्षेत्रमा अझ अगाडि बढ्ने र सेवा प्रवाहलाई निरन्तरता दिने र विशेषज्ञ सेवा सुरु गर्नको लागि बागमती प्रदेश स्वास्थ्य मन्त्रालय अगाडि बढ्दैछ। अहिलेसम्म बागमती प्रदेश स्वास्थ्य मन्त्रालय र बागमती प्रदेशमा 13 वटा जिल्ला छ, 119 वटा पालिका छ, 61,16,000 भन्दा बढी जनसङ्ख्या यहाँ बसोबास गर्नुहुन्छ र सबै क्षेत्रमा स्वास्थ्यको पहुँच छैन र अहिले पनि हामीले एकीकृत स्वास्थ्य सेवा सुरु गर्दै गइराखेका छौँ र त्यो एकीकृत स्वास्थ्य सेवा सुरु गर्दाखेरि स्थानीय तहसँगको समन्वयमा हामीले हेल्थ क्याम्प सञ्चालन गर्दा 1561 जनाको स्वास्थ्य परीक्षण गर्दा 109 जना भन्दा बढीको मोतीबिन्दुको रोग चाहिँ उहाँहरूको चाहिँ आँखा नदेख्ने त्यस्ता रोगीहरू चाहिँ हेल्थ क्याम्पबाट चाहिँ हामीले चाहिँ उहाँहरूलाई चाहिँ स्वास्थ्य उपचारको लागि उहाँहरूको आँखाको अपरेसन गर्ने तर्फदेखि लिएर जहाँ चाहिँ बागमती प्रदेशको एउटा चाहिँ मानव सूचकाङ्कबाट पछाडि परेको धादिङको रुबी भ्याली जस्तो ठाउँदेखि लिएर अन्य चाहिँ दुर्गम क्षेत्रमा अहिले बागमती प्रदेश स्वास्थ्य मन्त्रालयले स्थानीय तहसँगको समन्वयमा एकीकृत स्वास्थ्य सेवा तथा पोषण प्रवर्धनको कार्यक्रम अगाडि बढाएको छ। त्यो कार्यक्रमबाट त्यहाँका चाहिँ नागरिकहरूलाई स्वास्थ्यको अवस्था विशेष गरी आँखाका चाहिँ समस्याहरूलाई हामीले चाहिँ प्राथमिकीकरणमा राखेर अगाडि बढेका छौँ र उहाँहरूको जुन समस्या छ उहाँहरूको आँखा नदेख्नेदेखि लिएर त्यो कुरालाई चाहिँ प्राथमिकतामा राखेर हामीले उपचार पद्धतिमा अगाडि बढाइराखेका छौँ। त्यति मात्र नभइकन बागमती प्रदेशको 13 वटा जिल्ला प्रादेशिक 13 वटा प्रादेशिक अस्पताल जुन अस्पताल 25 बेडदेखि लिएर 300 बेडसम्मका अस्पतालहरू सञ्चालन छन् ती अस्पतालहरूमा यो वर्षबाट चाहिँ हामीले आँखाको विशेषज्ञ सेवा सुरु गर्ने भनेर हामी लागेका छौँ। यसको लागि नेत्रज्योति सङ्घ त्यसैगरी तिलगङ्गा रेउकाई जुन जुन चाहिँ आँखा सम्बन्धी सेवा गर्दै आइराख्नु भएको अस्पतालहरू छ उहाँहरूसँगको साझेदारीमा अब बागमती प्रदेशका प्रादेशिक अस्पतालहरूमा विशेषज्ञ सेवा हामी सुरु गर्दैछौँ। यसले गर्दाखेरि जुन यहाँ चाहिँ जसले चाहिँ जो पार्टनरसिपमा हामीले लिन्छौँ उहाँहरूलाई पनि केही चाहिँ भवन बनाउनेदेखि लिएर अन्य चाहिँ जग्गा खरिद गर्नेदेखि लिएर त्यो समस्या हुँदैन। हामीसँग भएको प्रादेशिक अस्पतालमा हामीसँग भवन छ त्यसैगरी जग्गा छ र त्यो ठाउँमा चाहिँ नि हामीले स्वास्थ्य सेवा एकीकृत स्वास्थ्य सेवा सुरु गर्न सकेको खण्डमा नागरिकहरूलाई हामीले सेवा दिन सक्छौँ। त्यसकारण पनि आगामी वर्षको बजेटमा हामीले आँखा सम्बन्धी जसले को चाहिँ अहिले सेवा दिँदै आउनुभएको छ, नेत्रज्योति सङ्घ, तेलगङ्गा, रेउकाई लगायतका अस्पतालहरूसँग बागमती प्रदेशका 13वटा प्रादेशिक अस्पतालहरूले साझेदारी मोडलमा काम अब अगाडि बढाउँदैछ। त्यसै गरी बागमती प्रदेशमा स्कुल हेल्थको पनि व्यवस्था जुन चाहिँ हामीले स्कुलमा सामुदायिक विद्यालयमा विद्यालय नर्सको व्यवस्थापन गरेका छौँ। अहिलेसम्म 848 जनालाई बागमती प्रदेशको विद्यालय नर्समा हामीले खटाएका छौँ, जुन विद्यार्थीहरूको स्वास्थ्य अवस्था बुझ्नको लागि र आँखा लगायतका अन्य चाहिँ उहाँहरूको उपचार पद्धति र स्वास्थ्य सेवा दिनको लागि बागमती प्रदेश स्वास्थ्य मन्त्रालयले विद्यालय नर्सको व्यवस्थापन गरेको छ। आगामी वर्षमा पनि त्यसलाई अझ बढी चाहिँ हामीले कन्टिन्यू गरेर त्यो थप चाहिँ विद्यालय नर्सको हामी व्यवस्थापन गर्दैछौँ, ताकि विद्यार्थीहरूको स्वास्थ्य परीक्षण गर्नको लागि र विद्यार्थीहरूलाई नै हामीले स्वास्थ्यमा फोकस गरेर जुन ड्राई फ्रुटदेखि लिएर अन्य कुराको लागि चाहिँ हामीले चाहिँ उहाँहरूलाई निरुत्साहन गर्नको लागि विद्यालय नर्सको व्यवस्थापन गरेका छौँ। त्यसै गरी बागमती प्रदेशभित्रका प्रादेशिक अस्पतालहरू, जुन अस्पताल हिजोको दिनमा पिएचसीमा सञ्चालन भएका थिए, ती जिल्ला अस्पतालहरू थिए, ती अस्पतालहरूमा अहिले 25 बेडदेखि लिएर 300 बेडसम्मका चाहिँ हामीले अस्पताल सञ्चालन गरेका छौँ र जुन अस्पतालहरूमा दैनिक चाहिँ ओपिडीमा दिनको 1500-1600 को हाराहारीमा अहिले बिरामीहरू त्यो अस्पतालहरूमा आफ्नो स्वास्थ्य परीक्षण गर्न आउनु भएको छ। त्यसलाई अब आगामी वर्षमा हामीले आँखाको पनि विशेषज्ञ सेवा जोडेर त्यो चाहिँ सेवा दिने प्रतिबद्धता पनि म यहाँ समस्या व्यक्त गर्न चाहन्छु। र स्वास्थ्य क्षेत्रमा भन्नु पर्दाखेरि बागमती प्रदेशभित्रका स्वास्थ्यमा गर्नुपर्ने कुराहरू र स्वास्थ्यलाई बढी चाहिँ हामीले विशेषज्ञ सेवाहरू सुरु गर्ने कुराहरू र विशेष गरी आँखालाई हामीले फोकस गरेर हामी काम गर्दैछौँ। र आज मे 1 आज अन्तर्राष्ट्रिय श्रम दिवस। श्रमिकहरूको लागि पनि हामीले अब स्वास्थ्य उहाँहरूको परीक्षण गर्ने, जहाँ जाने उद्योग कल कारखानाहरूमा पनि हामीले स्वास्थ्यको सेवा सुरु गर्नुपर्छ। र अर्को कुरा यो स्वास्थ्य बिमा छ, यो स्वास्थ्य बिमालाई हामीले श्रमिकदेखि लिएर उद्योग कल कारखानादेखि लिएर सरकारी कर्मचारीहरू सबैलाई चाहिँ यो स्वास्थ्य बिमा अनिवार्य लागू गरेपछि मात्रै हामीले चाहिँ स्वास्थ्य बिमालाई अझ प्रभावकारी ढङ्गले अगाडि बढाउन सकिन्छ भन्ने भनाइका साथ यो 3 दिने सम्मेलनमा उपस्थित हुनुभएका राष्ट्रिय अन्तर्राष्ट्रिय क्षेत्रबाट यो हाम्रो यो चाहिँ देशमा यहाँहरूले चाहिँ आँखा सम्बन्धी जुन चाहिँ यो कार्यक्रम राख्नु भएको छ, यहाँहरूप्रति म हार्दिक आभार एवं धन्यवाद ज्ञापन गर्दै मेरो भनाइ यहीँ टुङ्गाउँछु। हस्त, धन्यवाद, अभिवादन, नमस्कार।
Well, our huge thanks to the Honourable Minister for your time. YD, I think what we're after is a word-by-word... no.
Yeah,
perhaps a few highlights.
That's the impossible, I think. I have taken a few points. The important point, what he has taken, Honourable Minister has speak about. First of all, he addressed, of course, all the distinguished delegates from all over the world, and then the IAPB dignitaries and dignitarian dais in the front row, especially he addressed with the chairman of the IAPB and the president of the IAPB and the Honourable Minister of the Lumini province. That was the address. And then he started his statement with he was very happy to welcome you in Kathmandu, in Kathmandu city. And then in this 3 days gathering of all the international experts who are dedicated in eye health, working together, will definitely will elevate the eye health further up, and then wish all the success of this conference. And then more of the other focus was his commitment towards the commitment. He is very much committed to integrate the eye health into the mainstream health system. That was one of the priority he mentioned. And then with the examples of the many of the health camps, what the Bagmati province is doing within the rural and the remote areas, he has integrated all the eye care in those health camps, and that was also is a further will be promoted in the coming years. That is included in the budget. That's what's his commitment. And the other commitment was the province runs the provincial and the regional hospital, and there are 13 districts, which the 13 district hospitals, and many of the district hospitals still do not have the eye care services. Now he has committed that all 13 district hospital will have eye care in the coming years. That's it in the budget he has included. And another important commitment he has made is a school health and the school eye health. And then he has all the schools school have a school nurses, and that they are already in the process of the training in a primary eye care. 848 school nurses has already been trained by the Bagmati province on the primary eye care, and then he wants in his trainer that before he completes his trainer, all the school nurses will have eye care training, and the vision screening will be made possible in every school. That was his another commitment. Yeah. And then another commitment was in the labor, there being a Labor Day today, and the occasion coincided with the Labor Day. So he also promised all the industry workers and the government officials should also have eye care access, and all those people need to be included in the health insurance system. That's what we will be further work on. And then he also wishes these 3 days workshop will have a great success, and then we wish him all the success of this conference. Thank you.
Thank you, YD. Thank you to the Honourable Minister Tapa. We would like to present you with a gift of our appreciation. Thank you. Perhaps we could have a final show of appreciation for our 2 honourable ministers for joining us today. Today on what is, of course, Labour Day, May the 1st, and for us it's day 2 of 2030 Insight Live. I just want to take just 1 second to recognise that, yes, we hope we're delivering a series of good things in this auditorium. Actually, there is an amazing set of activations and sessions and roundtables and workshops happening all around the Swalti over these 2 days. So can we just take a moment to recognize the leaders, the speakers, the facilitators, the designers of every session that's happening across 2 days. We're massively grateful for it. Thank you. So everybody, I got to meet our next speaker in Dubai, then in Singapore, then in Mexico City, and now in the wonderful city of Kathmandu. We've seen him distribute gifts. We've seen him speak in, as far as I could tell, fluent Nepali. In Mexico City, I even saw him follow Kirk Humphrey. If you can do that, you can do anything. On a deeply serious note, if you're looking for a champion of the prevention of blindness, look no further than our next guest. He needs no further introduction other than to say I don't know if there's any Nepali in this speech, but it is always good to see someone I see behind the scenes connecting on a very personal level with each and every one of you here. Please welcome to the stage the Chief Executive of the IAPB, Peter Holland. Thank you, Peter. Welcome.
Ollie, thank you. Honourable Ministers, distinguished guests, namaste. That's as much Nepali as we'll have this morning. I think I exhausted my Nepali yesterday, I'm afraid. But thank you so much for joining us today and for such passion and the commitments that you've made. It's really inspiring for us. And I'd also like to thank the panel because that was an absolutely fascinating discussion. It's really left me, my mind's kind of blown. So it's really interesting. Over the past few days, it's been amazing to come together again. The strength of our movement lies not just in our individual expertise, but in how we work together across sectors, across borders, and across challenges. As always, it's been inspirational to see us collaborating as we have. And being in Nepal is obviously significant. As we heard yesterday, and we've heard again today, it's a country that's truly leading the way on eye health. A year ago, I stood in front of you in Mexico and announced that we were going to hold the first ever global summit on eye health. I said it wouldn't be easy and that the summit could not stand alone or exist in a vacuum. 1 year later, that challenge feels even larger than ever. Enormous geopolitical and economic changes have created a new landscape that we're all trying to understand and navigate. We're living through an extremely turbulent, challenging, and fast-changing period, a time of real jeopardy. The implications for international aid, health, and multilateral cooperation have been both immediate and profound. Reduced contributions to the World Health Organization and cuts to international aid programs don't just represent numbers on a balance sheet. They translate directly into fewer vaccinations, stalled HIV and malaria programs, and critical delays in health, infrastructure, and education projects in some of the world's most vulnerable regions. For many governments and leaders around the world, in the face of such turmoil and change, eye health won't be top of their agenda, especially when health systems are under such strain. So the challenge now feels bigger than ever. And that's why it matters. That is why we still need to make the case for the critical importance of eye health. Because if we don't, no one else will. One of our greatest strengths is the unity within our sector, a common and shared purpose that drives us all. And it is this, and our spirit of collaboration, that makes us truly resilient and able to rise to meet these challenges. We've made such great strides over the past few years. Eye health is already firmly on the agenda and recognised as having a key role in achieving the Sustainable Development Goals. But now we need to keep it there. Because with concerted action, eye health can unlock and address so much else. Because we know good vision increases access to education and work, it improves general health outcomes, and it is an essential part of improving productivity and economic growth. Through the UN resolution on vision, as well as through other political declarations and commitments over the last decade, and the hard work of everyone in this room, global leaders have already acknowledged the importance of the issue and committed to improving access to quality eye health services and making it part of universal health coverage. But leaders, in Ambassador Aubrey Webson's words, must now turn words on paper into action for people and implement practical steps that will bring these already agreements to life. We know what's needed. Eye care must be integrated into broader health systems. Governments and funders must prioritise sustainable financing for eye health. Regulation that enables, not restricts access, just like Nepal in removing tariffs and taxes from glasses earlier this year. Better monitoring at a national level. And today, as we've been reminded is Labour Day, is a reminder that at the heart of all health systems is the people who deliver. But there's more to it. We need to work in partnership, importantly both inside and outside our sector. And we cannot forget that true progress means inclusion, ensuring that everyone has equal access to services. Therefore, a global summit for eye health, and critically, the campaign that we build around it, not just for next year, but for the years to come, is more important and more urgent than ever. It will bring together global leaders to help solve what is one of the biggest but most solvable healthcare issues facing the world. It will act as a platform to galvanise global and national efforts to drive action. And yesterday, as we heard in the Prime Minister's speech, and indeed again this morning from the health ministers present, we saw powerful examples of how events like these can really drive action. The summit is not just a one-off event. It can't be one and done. It is about creating a campaign and a continuous drumbeat of activity and progress. It is how we persuade leaders and decision makers to take action on the global commitments they've already made. Leaders must be held to account. We're building momentum. Over the last year, we've been using our summit ambition to talk to leaders around the world, making exactly these arguments. Earlier in the year, we were in New York at the Commission on the Status of Women. Later this month, we will be in Geneva with an official side event at the World Health Assembly to encourage the adoption of a new resolution on vision and hearing impairment. And in September, we will be at the UN General Assembly to launch an up-to-date case for investment on eye health. The response from countries has been very positive. We have champions in every region of the world, including, of course, in Nepal and Antigua and Barbuda. Working with our champion countries, I expect soon to be able to make announcements about further high-level meetings that will be part of the campaign, including the Global Summit. We've all been working hard to get us to this point. There is more hard work ahead. And we need all of you to help. We need all of you to help build this campaign. To be a success, we need to mobilise as many representatives from as many countries as possible to come to the summit and discuss and agree their own plans and commitments. To achieve the goal of galvanising national action, we will need the help of everyone here today to engage with their own governments and make our case. Because above all, we must remember this is about everyone who needs good eye care. People with dreams, with families, with jobs, and with ambitions that deserve to be realised. Behind every number is a child who wants to learn, a worker who wants to provide, a person who wants to stay active. Every story counts. Take 19-year-old Tula, paralysed due to polio, but it was vision loss that forced him to drop out of college. Today, with a pair of glasses, he has a career and supports a family. Or 80-year-old Mangal here in Kathmandu, who regained her independence after surgery, having spent 7 years blind due to cataracts. Or my own daughter, who I talked about last year, who now, with good eye care, is able to embark on her end of school exams with confidence. We all have these stories, stories that need telling. That's why we need your help to tell these stories and turn them into deeds, turn words into action to make our case that eye health matters, because together, this is the difference we can make. Thank you.
Thank you, Peter.